additional manpower? I mean,
No, it will not be.
so as of the moment, my partners, I have two partners with me. Maybe the police is there. We don't need additional resources.
Yes.
What's the mechanism of injury?
He hit a post in the middle of the road and then fell off the bike, and he's now 10 meters away from his bike.
So high crash motorcycle
Yes,
accident. And
apparently he was on a high speed.
Okay then, so we are approaching our patient. General impression of the patient.
He's a
body
middle-aged male. He's lying on the ground on his back. He's screaming of pain, so apparently he's conscious.
Yes,
A little bit confused, but he's still conscious and screaming of pain. There is no major bleeding around the
So
patient.
there's no immediate like major bleeding noted?
No.
Nothing. Okay. So upon approaching the patient, I'll first approach my patient from the foot side. Hey sir, don't move. My name is Jake. We're here to help you. Okay? Is the patient responding?
He's responding and says, "Please help me."
Okay, partner, can you do a manual inline stabilization of the neck?
Very
So the patient's level of consciousness, since the patient is talking,
He's talking, so he's conscious.
He's conscious.
A little bit confused, not answering all your questions, but his airway seems to be open because he's
okay,
screaming.
the patient's airway is open because he is talking. Is there any vomitus, any blood in the
No.
patient's airway that I need to suction?
No.
Nothing. So I'm going with my breathing.
Breathing rapidly and
while
shallow.
in the
Rapid and shallow
rapid and
breathing.
shallow. So
Apparently more than
partner,
20.
I will instruct my partner to administer high flow of oxygen via non-epidermis.
Very good.
So I'm done with my D, I'll go with my C. I'll check for pulses.
The pulse is weak and rapid.
Rapid and weak pulse.
Yes.
How about the skin color temperature?
The skin is cold and clammy and very moist.
So again, I want to emphasize, is there any bleeding that I need to control right
No
now?
major bleeding, no.
How about the CRT? CRT.
It's about 2 seconds so far.
2 seconds so far. So, okay, I'm finished my initial assessment. This patient is a load and go patient because of the mechanism of injury, because of the abnormal mental status, abnormal respiration, and abnormal perfusion. So I'm going to do my rapid trauma survey. Partner, can you prepare the BBM, the spine board for me while I'm doing my rapid trauma exam?
Right.
On inspection of the head and face, do I see any obvious injury on the head and face?
No obvious cut wounds or bruises on the face.
No obvious injury. On palpation, do I feel for any tenderness, instability, and crepitation on
No
palpation?
tenderness, no instability or crepitation on the scalp.
Okay, and on the face and head as well?
No.
Okay, psychomas, and as well mandible. Exposing the neck. On inspection, do I see any obvious injury on the patient's neck?
No obvious injuries or bruises on the neck.
How about the neck veins?
Flat.
Flat neck veins, okay? How about on palpation? Tenderness, instability, and crepitation on palpation, and step up?
No tenderness, no instability, and the trachea is central.
Trachea, midline, central.
Yes.
Okay, partner, can you insert an C-collar for me?
This is the perfect time.
Okay, expose the chest.
Right.
On inspection, do I see any obvious injury on the chest?
No obvious injury.
Asymmetrical chest wall movement, paradoxical chest wall
No
movement, and
paradoxical.
sucking chest wound? Nothing?
No sucking chest wounds.
On palpation, tenderness, instability, and crepitation on
No.
palpation?
No tenderness or instability.
Sternum intact?
Yes.
Okay. On auscultation, upper,
Equal
Upper.
bilateral breath sounds.
Lower.
Only shallow and rapid, but equal.
shallow and rapid. How about the heart tones?
Normal heart sounds, but rapid.
Up and down tones. Okay, since the patient's breath sounds are normal, I don't have to do percussion.
Okay.
Okay, going on the abdomen. In the abdomen, on inspection, do I see any obvious injury in the abdomen?
Yes, there seems to be contusion on the whole left side of the abdomen. Bruises on that left side as well.
Left side, on my left side. Okay then. So how about left side? Left side.
Yes.
Okay. On palpation, upper.
There's
Upper.
tenderness all over, upper
There's
and
no.
lower.
How about rigidity on palpation? So
There's tenderness, not
Tenderness,
rigidity.
okay.
There's tenderness on palpation.
okay. I'm suspecting an abdominal bleeding right now. In the pelvic area, on inspection, obvious injury.
No contusion, no lacerations.
On palpation, in and down,
It's stable and no tenderness.
stable pelvis. Okay, good. No TIC as well.
No tenderness.
Expose the lower extremities.
Yes.
On the right lower extremity, on inspection, do I see any obvious injury?
No, no obvious injury.
Tenderness, instability, and crepitation on palpation. How about the pulse?
The pulse is weak and rapid.
Sir, can you move your finger or toe?
Oh, he moved it.
Okay, can you feel me touching your toe?
He didn't answer that. You pinched him,
So I pinch him.
he moved it.
Still, there's some sensation. About in the left lower extremities, on inspection, do I see any obvious injury?
No obvious injuries.
On palpation, tenderness, instability, and crepitation on palpation.
No.
Pulse,
Weak and rapid.
same as well. Motor and sensory. Sir, can you feel me touching your toe?
He wiggled his toes when you pinched.
Can you move it?
He
can.
moved it, yes.
Okay then. So I'm done with my lower. On the upper extremity, right upper extremity, on inspection, do I see any obvious injury on
No obvious
inspection?
injuries on the outer.
Tenderness, instability, and crepitation on palpation.
No
Pulse,
tenderness or instability. The pulse is weak and rapid as well.
rapid and weak. Can you feel, sir? Can you feel me touching your finger?
Yes, he
Can
can.
you move your fingers? Same as well on the other side.
Yes.
Obvious injury on inspection.
No obvious injuries on
Tenderness, instability, and crepitation on
no
palpation.
tenderness, no.
Pulse.
Pulse is there, but weak and rapid.
So how about the motor and sensory? Sir, can you feel me? Can you feel me pinching you?
Yes, he could feel.
Can you feel? Can you move your fingers?
Yes, he moved it.
Okay, now I'm done with the anterior part. I'm gonna check the back. So I'll ask someone to help me. We're gonna lab roll the patient, and also I'll ask partner. And once we lab roll, we will put the patient on the backboard. Okay. He's fine. I want you to take charge. We're gonna lab roll the patient.
Okay, am I count? Ready?
Ready?
1, 2, 3.
Upon lab rolling, I'm gonna check for the back. This will be the first and the last time I'm gonna check the back. So I'm checking for D-cup ITLS.
There is no deformity, no crepitation, no laceration, and no tenderness or instability.
On crepitation. Okay, now good. We're ready to lab roll the patient onto the backboard, partner.
Ready?
We're ready?
1, 2, 3.
Very good.
Okay. So while we are preparing for packing, may not be able to get some history to the patient. I can get sample history
Right.
on the street.
So sample history is the S, is the symptoms that he feels right now. He's got abdominal pain.
Allergy,
He's allergic to penicillin.
penicillin. How about medication?
He's on insulin.
Insulin.
Yeah.
Okay. How about the last oral intake?
2 hours ago.
So events, he was just riding his motorcycle, then he
Yes.
hit the pool and ejected from the vehicle.
Right.
Now after doing that, we will immediately transfer the patient at the back of the ambulance. At the back of the ambulance, what will I do? Since the patient is fully mobilized, I will instruct my partner to put the patient on the cardiac monitor. Give me sets of vital signs, the blood pressure, the heart rate, the pulse rate, SpO2, EtCO2, and random blood sugar as well as part. And partner, I want you to insert IV access for me while I'm doing my brief neurological exam since the patient has an altered LOC.
Very good.
Pupil.
The pupil are equal and reactive.
How about the GCS?
One
Measure.
is responding to painful stimuli, and the eye opens to painful stimuli as well. So his GCS is around 14, 13.
14 to 13. Okay. Any medical alert tag?
No,
How about focal neurological signs?
there's no signs
Abnormalities?
No, there's no signs of brain herniation.
So, okay, partner, are you done with the blood pressure?
Are you ready
With the
for
vital signs?
Okay, so the pulse rate is 130
Mhm.
and the blood pressure is 85/50.
So this is typically signs and symptoms of shock. So I
Yes.
will instruct my partner to give IV fluid bolus. This is 500 ml as of the moment. And at the other hand, also insert another IV line.
Very nice.
Then while we
Right.
on our way to
On our
the
way to the hospital, what are you gonna tell the hospital?
So how many minutes involved, sir?
About 5 minutes.
5 minutes. I will do my reassessment since I don't have time to do the detailed exam because I'm doing rapid. I only have 5 minutes. So on the way to the ambulance, I will report to the medical director, to the hospital,
Yes,
missed,
exactly.
the missed. So what's the mechanism of injury? The patient was riding his motorcycle, high-speed motorcycle, ejected from vehicle, right? And injury, I got some possible intra-abdominal bleeding.
Excellent.
Okay.
Excellent.
And the signs and symptoms, the patient has an altered LOC, of the signs and symptoms of shock,
Yes.
and some
abdominal pain.
abdominal pain.
Right.
And interventions, we have put him on high flow oxygen, On long backboard, IV access, fluid bolus 500 ml,
That's
500 ml, ETA 2 minutes.
Thank you very much, sir. Thank you.
Thank you.